Welcome to our Beyond 20 campaign, a celebration of One Joshua Group's 20 years of service excellence. This is a One Joshua Group production, providing access to information and experts to help improve quality of life and health outcomes.
Thank you for joining us for Beyond 20. We're more than excited today to have our guest, Dr. Latrice Rollins from Morehouse School of Medicine. And Dr. Rollins and her team at Morehouse School of Medicine explores a topic, of course, that's very near and dear to me, and that is the impact of Black men, the influence of Black men, and the importance of the role of Black men and families. Dr. Rollins, thank you for joining us.
Thank you for having me.
So, Dr. Rollins, we have this new center at Morehouse School of Medicine.
Yes.
Tell us about that center and why it's important.
Yes, absolutely. So we have the National African American Child and Family Research Center. It's a long name, but that's what it's called. And so it is really the first ever center that the Administration for Children and Families has funded to look specifically at Black children and families in America. We're looking at the TANF program, so Temporary Assistance for Needy Families, Head Start, Early Head Start, and Child Care Assistance. We know that there's a lot going on here in the States about child care, a lot going on about early education. We focus so much of our energy on children kind of K through 12, not understanding that a lot of the brain development, all of the type of outcomes happen very early. So being able to kind of have a center focused on our families, particularly in those early stages, and also looking at economic mobility. So not just the Temporary Assistance for Needy Families program, but how do we make sure that our families are able to advance and get the types of careers and get the types of income and things that they want. And so being able to look at that in terms of in the confines of Morehouse School of Medicine, which is usually focusing on very explicit health issues, but understanding that education, income, the ways our families kind of congregate and things, that those are kind of those social drivers of health. And so we were leaning more in the public health realm and medical realm to understand the full kind of holistic view of persons and of families. And so I'm happy to have the center at Morehouse School of Medicine to be able to contribute, we need to look at education, we need to look at early care, we need to look at the economics and those type of things, because those also drive health. So very excited to have the center. It's new-ish, established in September of 2021. And so we're still working to develop our research agenda and figure out what are the things that are really needed to understand in our community. So
Now, Dr. Rollins, this is a redundant question.
Okay.
But I want to ask it in redundancy because there is a lot to unpack in what you just said.
Yeah.
All of it important.
Yeah.
Why is the center important?
It is important because of all of the various inequities that our families have experienced. It's important for us to have data that really provides the evidence of that, and not only highlighting the issues, but being able to contribute to solutions. And so a part of our center's objectives is not only to understand the needs and experiences of Black children and families that are participating in those programs, but also to do some case studies around strategies, around promising approaches that work in those spaces. So we know that policies and programs are informed by data. We need data specifically for our children and families. So that's why it's important. Yeah.
Well, I'm smiling because there's a word now, research. But the most important part about that is this evidence-based information will be for us,
right,
about us, and the most important part, by us.
By us.
Us. So, and not BIAS, but BYUS.
That's right.
By us.
Right.
The
FUBU. For us, by us.
Right. So, and not for us, biased. So congratulations on the award and on the center.
Yes.
and I'll say this again, I'm just so excited about the center because it's about me.
Yes.
And we've talked about that before. So I
Mhm.
see all the work that you're doing in the community, and just to be able to ask the right question, the cultural
That's right.
part about that.
That's right.
And I know from my personal experience that a question can be asked that causes me to be defensive in my answer
Mhm.
rather than making a contribution as a response to the question that you asked. So again, we commend you on doing that. So I heard you discuss a change in the narrative
Mhm.
about African American families and that experience. How do you
Yes.
get at that in helping to identify the best practice in your center for children and families of the African American lived experience? How do you get to that differently than the way we sought that information?
Sure. So definitely taking a asset-based approach and strength-based approach. A lot of the research that has been done, particularly when we're talking about families with lower incomes,
Mhm.
has been from a deficit perspective.
Mm.
Like, what do they need and what's going wrong with them? What do they need to do to change? As opposed to looking at, some of the issues with the systems and with the programs and structures that have kind of put people in certain positions.
Mhm.
And so being able to take that asset-based approach, what are the resources? What are the things that these families are doing in spite of, that are helping them to still thrive? Looking at that and also taking that community-based participatory approach, right? Not going in and saying, this is what we want to do as a research center, this is what we want to explore, but going in and understanding from the Black caregivers and the children's perspectives, what is important to you all? What have you all been doing to kind of manage, in spite of all of the things that are going on in society? And again, having lower incomes, having various barriers, how are you all continuing to thrive, and how can we support that? What data would be important to you? Something that has been really important for us is to make sure that data is available to community residents, because there are a lot of leaders in the community that are going to those city councils and going to various meetings and advocating on behalf of our communities. And so they're like, they need that information. And so being able to empower them with that and share those stories, I think, switches the narrative from, these communities that are just waiting for someone to come in and, do all these various things. They're active. They're doing what they need to do. They absolutely do need more resources. They do need more of the investment. But being able to highlight the resources, highlight the strengths, I think that changes the narrative. And also, again, not focusing on something is going, or they're doing something wrong, or they didn't take advantage of whatever opportunities. No, understanding that there are a lot of structural and systemic barriers that prevent folks from advancing. So
yeah, this conversation always makes me smile.
I'm glad.
It's coming into our communities. They're our communities. We don't come into our communities.
Right.
We live in our communities.
Right.
So I think that's when we, people in the community, can ask the questions to people of the community,
right,
and know the cultural components of asking those questions. And sometimes we hear the discussion that the Black family is not the traditional family. But isn't the traditional family what the family is? So how do you think Black families are different from the traditional families?
Yeah.
Where did that come from? Who defined that traditional family? Can we just talk about that?
Be PC. So I say that has harmed us, in terms of who defines traditional or nuclear, because as Black people, we are not in this traditional, like just who's in our household is considered the family. We have always had this kind of village community kind of mindset from before we reach these shores, right? And so being able to have these various policies that only look at mother, father, child as family, and if there's any deviation from that, then there's something wrong, right? That's seen as this dysfunction or something like that. You know, I mean, and most families don't in our culture, you know, don't operate that way. We have mom, dad, grandma, cousin, brother, you know, uncle, like everyone kind of pitches in and contributes. And so you have to understand there's a broader kind of social support system beyond just, you know, the mom, dad, child, you know, and when there is, you know, folks that are unmarried, that have children and things like that, there's a number of policies that, like, you know, just really hit those families hard in terms of penalizing because they don't fit into that traditional kind of model. And so it hurts us, you know, and where it comes from, you know, we all know it's stemmed in racism. It's stemmed in this standard that, you know, is more Eurocentric than it is Western and where we come from.
So you must have been reading our notes because you introduced the word policy. And our next question is, what most often separates Black men from their families?
Yeah. I mean, it is a lot of policy. I do tend to think of things more holistically, kind of using this, what we call a socio-ecological model, right? You're looking at the individual, you're looking at the community or family system, and then you're also looking at kind of these societal structures. So it's like all of these things, these various systems are interdependent. So yes, we do know that there are some individual kind of things that contribute to separation. It could be adverse childhood experiences. Maybe father never had a good relationship with his father, didn't know, you know, how he needed to interact. So those things can certainly play a part. Mental health issues. There can be an incarceration. You know, there could be a number of different things that like separate someone individually. But we do also have these policies and laws that I talked about when folks are unmarried and have children, such as like legitimation here in Georgia. It is horrendous. It is horrendous that a father does not have legal rights to their child until they go through this whole process, right? And so, and Georgia is the only state that has it like that. And so there is no way for that particular father, if the parents are not in agreement. Now, if parents agree and they're a good relationship, this never comes up. But if there's a kind of adversarial relationship, the way that the policies are set up, it's really not on the father's side to be engaged with their child through the legitimation. You have to have the legitimation in order to go through and have a custody kind of order and things to be able to see the child at least. So there are a lot of different things, policy and systemic wise, that prevent, you know, fathers from engaging the way that they want to. But I do want to counter and say, because I don't like to always focus on the separation part, right? We do know from research that particularly Black fathers are the most engaged of all fathers. And when we say engaged, we're not talking about just in the household, right? They're helping with homework. They're helping with diaper changing. They're helping with preparing meals across the board. And these are fathers who are not in the home, non-residential fathers. When we look across all races, Black fathers are the most engaged. And so
didn't know that.
We
don't hear that.
We don't hear it.
No, we don't hear that.
You don't hear it. And so that was a study done.
I'm not surprised, but we don't hear it.
Exactly. And we keep getting the messages out of like, well, where are all the dads? You know, these dads are not showing up in that. And I'm constantly putting out pictures of like, we asked for dads to come and here, look at this room is full. You know, here's this study that says now, I think this past census showed that there are more fathers that are living in the home with their children. Like this is the first time that there was like this increase.
Congratulations.
So I ended up doing it. Well, but it's just like, you know, it's the first time that folks are starting to highlight some of these positive statistics and instead of just saying 70% of children are in single mother households. And it's like, okay, They may be, but you can't use that to say that fathers are not engaged, because they may be in a single mom household, but the dad may still be involved. So we're starting to get there in terms of being more fair, I guess, with the statistics.
And your center sharing that information and becomes a new part of the new language, a new part of the discussion. And that adds hope. I mean, it lets people know that although we've known it, it lets other people, and I don't know that we knew it, it lets people know that there is an opportunity for hope. And with that, I'm sure that resources are available, the other word that you mentioned. So tell us about some of the resources in the center, generally, for children and families.
Yeah. So as a center, we do research. So we don't necessarily provide services per se. But in terms of resources, we do have a number of different programs. So one is our community pilot project program, where we provide funds to community-based organizations to conduct their own research, particularly in these spaces around the TANF program, Head Start, Early Head Start, and that. Because what I learned, even as a doctoral student, a lot of the things that community-based organizations are doing are innovative. They're already doing what like research is saying we should do, and they're doing it already. They may not have the papers, they may not have the data to like back it up. And so by equipping them with some funds to kind of document, these are the things that we're doing and these are the things that we're finding, we're hoping that they'll get more support and get more funding to support the work that they're doing and also document the brilliance that's happening in community. So that's one resource. We also have the Emerging Scholar Program. And this year we're starting with undergraduate students as well, to make sure that they're exposed to research. As we said earlier, the FUBU, for us, by us, we want to make sure that we have a diverse research workforce. And so those students who are in social work and public administration, public health, education. We offer mentoring opportunities with our co-investigators so they can work on research that we're doing. They can work on their own research, but exposing them to this world of research, non-academic or academic. But we just need more of us providing the data and asking the questions, like you said, the right questions to inform more equitable programs and policies. So, yeah.
So how is the faith-based community involved in this initiative?
I do want the faith-based community to be more involved in terms of, especially when we're doing our community listening sessions and community engagement. That's kind of where we have been able to get some pastors and some ministers to come in and like share their perspectives in terms of like what is important to the community and that type of thing. But I think we do need to work more on making sure that we are reaching those leaders and the patrons of the members of the church, that they get the information and they're able to share it with their families and things. Because one thing that came out is there's a lack of awareness about resources and programs that are available. And so I think that our churches could be very instrumental in sharing and partnering with us to share some of the research and share some of the information about these programs so that folks have better access, right? So I do want to continue to build that relationship in the states that we're working with. We focus in on the states where there's a high population of African Americans, and you can probably guess, definitely the South, right? So starting from Mississippi, Louisiana, Alabama, Georgia, North Carolina, South Carolina, and then we jump up to DC, Maryland, Virginia area. So we're focusing in on those 9 states where we are primarily. And so if they're, churches and, kind of those coalitions of Black churches in those areas, would be definitely great to partner with them.
So I just want to restate this, that the center is engaged in 9 states.
Yeah.
That's national.
Yeah. Well, yeah. I mean, we are a national center, but we wanted to, it's so much. There's so much stuff to do. National. So we're like, let us figure out where we are mainly, and then go there and dig in and see what's really happening on the ground. And it's been interesting. It's been an interesting ride.
And I can just imagine this subject of families, children and families, and
Yeah.
working in the faith community and working in many other communities.
Mm-hmm.
We talk about social, cultural, and the mores that go
Mm-hmm.
along with, and the morals, of course, that go along with some of those discussions.
Mm-hmm.
The challenges of really looking at what's important.
Yeah.
And what's most important is the benefit to children and families
That's
without
right.
being, what is the word, judgmental,
Oh yeah.
I guess, without having a different kind of bias, because bias is bias.
Uh-huh.
It's still bias, and looking at that.
Mm-hmm.
So health, clearly, you mentioned mental health.
Yeah.
So fathers and children must also be impacted health-wise from not having the support system, about not having these resources, but most of all, having the kind of resources that the center provides. What kind of direct health resources does the center provide for your constituency and those people you support?
Yeah, so we look at health in a holistic kind of point of view, right? Because we don't specifically focus on health outcomes per se,
right.
Because those programs, they're, federal government, they're very strict.
Yeah, I can imagine.
Funding comes from TANF, so focus on TANF. And funding comes from Head Start, Early Head Start, and those child care assistants, so focus on that. However, in having these conversations with community, and we all know this, we as people are not siloed like that.
Mm-hmm.
So when we're talking about TANF, when we're talking about Head Start, Early Head Start, people are bringing up mental health. People are bringing up physical health issues. They're talking about the lack of access to doctors in their areas, because one of the things that we focused in these states are those rural communities, because a lot of research, particularly about us, is in urban areas. So there's a abundance of research about African Americans in urban communities, but not a whole lot about rural. So when we focus in on those rural communities, they talk about not having doctors within, a decent radius.
In those same states.
Exactly. Talk about not having hospitals, those types of things. And particularly when you have children with special needs, or exceptional children, as I heard before, not calling them special needs or children with disability, but exceptional children. There are certain things that they need, and having to travel 3 hours or whatever to the more urban areas is a big deal. And so what we're continuing to advocate for in the center is this broadened view of making sure that these different programs are not, because they're not solely focused on health, that they don't disregard health, that they understand this is what we're hearing from the community. So somehow, way, you all need to loop in health resources or health access. And Head Start has been really great about doing that and providing kind of wraparound services to their program. I think one of the Head Start centers here has a nurse in their center. And so making sure children have access to appointments. So as a center, being able to lift up those type of case studies and those types of resources and examples to program developers and to policymakers, like, this is something that we need to also address. I know you're focused on making sure Baby has this evidence-based curriculum and, that they have these, certain ratings and quality ratings for the child care center, but they also need to make sure that their health is well, so.
Yeah. I thought about your center a couple of days ago. I was watching TV, as I sometimes get a chance to do, but I watch the commercials more than anything else.
Okay.
So there was a commercial about a young man and his father been incarcerated for 11 years. You may have seen that commercial. So they're sitting at a family gathering, and the father comes in and sits down, and the little boy looks, because he doesn't go see his father regularly. And he was just so overcome that his father was there. And the commercial made it very clear that although the father was incarcerated, he was still a part of the son's life. So there are more than one way to be present.
Absolutely.
And so a program like this helps people understand that.
That's right.
and helps to keep the family together. Now, this is the part that and thank you for your center and for what you do and continue to do in all 9 of these states. And we know it'll probably be a few more states the next time we have this follow-up conversation.
Are
But
you advocating for some?
I am advocating for that.
Okay. All right.
We're going to plant that, okay?
Okay.
We're going to commission that to happen. So this is the important part about this. We want to know about your journey.
Oh,
We want to know about Latrice Rollins. And
Okay.
when did you decide that this is what you wanted to do? And why did you decide you wanted to be involved in this?
Mm-hmm. And this is so many things, right?
This is so many things.
So I think briefly, I started out working with the state of Georgia in their child support enforcement office. And so I came out of Spelman College. I want to change the world. I want to make a difference. I want to help people. But I didn't really, in saying that, didn't have a specific population or a specific way that I wanted to help. So getting this job in the Department of Human Services was like an entree. Mm-hmm. I quickly learned that there are a lot of bias in the systems and a lot of just injustice in terms of the ways in which we look at families. And by me, I don't think it's coincidence that this kind of winded up being my route, because I had, from elementary school, I had best friends that were raised by single fathers. Middle school and high school best friends that were raised by single fathers, and they kind of took me in, as their daughter as well. Of course, I have an excellent relationship with my dad. So it really being in that environment where it was so many negative kind of portrayals, particularly of Black fathers, I was just like, I can't, this can't go. I was the agent who was going to the jails to advocate for the dads. I was the court agent, so administrative, civil, and criminal court. I was going with our assistant district attorney to make sure that there was kind of some fairness happening in terms of those child support cases. And so from there was an opportunity to work for the Georgia Fatherhood Program. And I was like, oh yeah, I'm out, because I'm out. I can't keep on with these child support orders and things like that. And I mean, as an agent, I really did take the responsibility of advocating and educating the fathers about the system. But I knew that there was so many kind of built-in injustices and things that I could not do, right? So I needed to go up in order to really inform and have an impact on policies and programs. And I knew that took more than my degree at Spelman. I needed to go a little bit. So from there, I decided to go and get a doctorate in social work. That's going to give me the tools to do research and evaluation, which again, I thought would help me to inform programs and policies to better support the fathers, but also, children and families. And so it was not a linear kind of path of just going straight, but it was always in my mind that I want to be an advocate. I want to have impact on a larger level, not just, and not to say anything's wrong with frontline workers, but I'm just hearing the same stories, seeing the same things, not being able to do. I was like, there needs to be change at a higher level in order for there to be, more impact. So that's kind of what got me into really working with fathers and really doing research, because I knew that drove policies and it drove programs. So
we appreciate that, and we want you to close this section with your 30-second elevator speech about your center.
About the
center. Tell us exactly what it is that you are doing, and when you reach out in these respective communities in these 9 states, that they need to come running, because you can share with them information and about advocacy and resources that helps make our community better, but much more so it improves our lived experience. We learn more about research. So let's hear your elevator speech about the center.
You did it right there.
No, I've been listening. It just shows how well you've shared that information.
Well, yeah. So I think, the center in 30 seconds, it is our avenue. It's the first ever center that's focused in on Black children and families. It is our opportunity to share with those decision makers, with TANF, Head Start, Early Head Start, all of these issues that really matter to us, get the data that's going to inform them to better serve our families, and also give us data that'll help us better serve ourselves.
So thank you very much, Dr. Latrice Rollins from Morehouse School of Medicine. This is another one of our servant leaders. We're so excited to be able to share this information with you on our Beyond 20. And thank you, and stay tuned to our future podcast where you'll learn more about what One Joshua Group is doing in the community. Stay well, stay safe, and be kind.
This edition of Beyond 20 is a Life Beat podcast sponsored by One Joshua Group, your strategic source of engagement to improve life through better health, education, and information. For more information, visit us at theonejoshuagroup.com or follow our work on LinkedIn, Facebook, Instagram, and Twitter using hashtag OneJGCollabs. One Joshua Group, building capacity, expanding resources, joining what you know with what we've learned.